Health insurance for new immigrants to the United States. Accessing the healthcare system in the United States is one of the top concerns for new immigrants. With a complex health insurance system and high medical costs, immigrants need to understand the insurance options available to them based on their immigration status, income level, and personal needs to avoid serious financial risks. This essay provides a comprehensive overview of the health insurance options available to new immigrants in the U.S. and explains how they can navigate and benefit from the country's healthcare system. In the U.S., health insurance is not mandatory under federal law, but going without it can lead to overwhelming medical bills in the event of illness or injury. The American health insurance system includes various forms: government-funded programs, such as Medicaid and Medicare, private insurance through the health insurance marketplace, employer-sponsored insurance, and other support programs. For new immigrants, eligibility for these programs depends heavily on their legal immigration status, duration of residency, and financial circumstances. One of the biggest barriers new immigrants face is eligibility. Lawful permanent residents, green card holders, are generally eligible to purchase insurance through the health insurance marketplace upon arrival in the U.S. They may also qualify for financial assistance, premium tax credits, if their income meets the required thresholds. However, to be eligible for Medicaid, a joint federal and state program for low-income individuals, most immigrants must wait 5 years after receiving their green card, with some exceptions for children or pregnant women, depending on state rules. For undocumented immigrants or those not yet eligible for Medicaid, access to health insurance is extremely limited. They are not allowed to purchase insurance through the marketplace and cannot receive federal subsidies. However, some states like California, New York, Illinois, and Washington offer their own programs that provide health coverage to undocumented immigrants, especially children and pregnant women. Additionally, nonprofit organizations, community health centers, and hospitals may offer free or low-cost health care services to uninsured individuals, including undocumented immigrants. Another common option for new immigrants is to purchase private health insurance while waiting to become eligible for public programs. Short-term health insurance plans or travel/visitor insurance can help cover basic medical expenses. However, these plans often lack comprehensive benefits and may not cover pre-existing conditions, making them less ideal for long-term health care needs. Some immigrants may receive health coverage through employment if they are formally hired by companies that offer health benefits. This is often one of the best ways to access high-quality health care at a lower cost, since employers typically cover part or all the insurance premiums. However, not all new immigrants can easily secure jobs with health benefits, especially during their initial period of settlement. Refugees and individuals under humanitarian protection tend to have better access to health insurance. They are often eligible for Medicaid immediately upon arrival. In addition, the Refugee Medical Assistance (RMA) program offers short-term health coverage during the first 8 months of resettlement, after which they may transition to other insurance programs if eligible. Similarly, asylum seekers who are granted asylum may also access public health insurance programs. It is important to note that each U.S. state has its own policies regarding health insurance programs and immigrant eligibility. Some states are more welcoming and have expanded public health care programs for immigrants, while others have stricter regulations and provide less support for non-citizens. Therefore, the state of residence plays a significant role in determining health insurance access. Another critical point for immigrants to consider is the public charge rule, a policy that once raised concerns about whether receiving public health benefits would negatively affect green card or citizenship applications. However, since 2021, the federal government has removed most healthcare-related benefits from the public charge consideration. This means enrolling in Medicaid or receiving financial assistance for health insurance will not harm one's immigration status or application. To find the right insurance plan, immigrants should seek assistance from local immigrant support centers or insurance navigators. These organizations often offer services in multiple languages and can guide new arrivals through the available options, eligibility criteria, and enrollment processes. Many also offer free help with completing applications for the marketplace or Medicaid, ensuring that immigrants do not miss out on vital healthcare resources. In conclusion, health insurance is an essential consideration for new immigrants arriving in the U.S. While the American healthcare system is advanced, It is also expensive, and lacking insurance can lead to serious consequences for both health and finances. Despite numerous legal, administrative, and financial obstacles, immigrants still have various paths to access appropriate health coverage if they receive the right guidance. A proactive approach, combined with accurate information and community support, will help new immigrants settle more smoothly and feel more secure about their health as they build a future in the United States.